Okay, Ma Mercy, let's continue with number 2. Can you give us examples of yin associations?
Uh, in association, it is associated with material,
Mhm. Okay, nawawala na naman. Ano ba to?
uh, form,
Mhm.
grow, it grows, substantial,
Okay.
um, matter,
Mhm.
researching.
Okay. Okay, whatever. So, um, it's about completion, responding, tranquility, stillness, drawing inwards, storing, amassing, yung mga papunta sa'yo, that's yin. And
Right, of
the trunk, legs, stabilization, inside storage cushion. So, what are the yang associations? Example.
examples are like dynamic, external, warm, bright, functional,
Okay.
excitement, commotion, warming,
Mhm. Yeah, also,
material,
yes.
generate,
Transformational, no? Generating. Yan. Ano pa ba? Spreading outward.
expansion,
Function,
rising,
yes.
expansion, rising,
Mhm.
uh,
Changing, outside, upper body.
love,
Yan.
fire,
Okay.
heat,
So
upper body.
you got it now. Okay. Let's go to the primary definition of yin yang. So kung may primary, there is a secondary definition. So can you tell us what is the primary definition of yin yang?
Okay. This is right. It's like two phases of cyclical movement.
Okay.
Constantly into other,
Mm-hmm.
such as the day giving way to the night, summer to winter, growth into decay, and cyclical movement. Ay,
Okay. When you talk about it's yeah, so I think the signal is so poor. Okay, primary definition. We always capitalize yin and yang if we are referring to the universe, not the guiding forces of movement in the universe. Okay, so there is contractive rest and expansive activity. So when we talk about secondary definition, we don't capitalize it, no? And this refers to anatomy and physiology of the human body. Okay, so in anatomy, okay, anatomy is yin, physiology is yang. Okay. Okay. So yin and yang.
structure,
Yeah.
structure and
Okay. So when there is movement, there is metabolic activity, there is function, that's yang. So if it's the anatomical part, the structure or the
structure.
stored potential, that's yin. Okay.
Uh,
So when we say that someone is suffering from excess yang, we are using the secondary definition. So you don't capitalize it. Okay, it is only when we refer to the universe. So we don't usually do that, Mandito. So you don't capitalize the yin yang. Now let's discuss the yin and yang in cosmology. Name the 4 seasons. Ma Mercy?
spring or the dawn, lean. Yes. The spring,
Okay.
summer, autumn, and winter.
Yes, all 4. So in Chinese medicine, the yang, the heavens are the yang. Heaven and earth. So earth is yin. Okay. Anything that is, yeah, light and dark, cold and hot. Okay. Birth is spring. Okay. East, dawn. Growth, summer. Okay, you just read through this. Eventually, you will encounter all this as we go along. Now, let's talk about pathology, the thing that interests us. Okay. Can you tell us about it? Tingnan nyo to. Look at this. What we want to achieve is a balance of the yin and yang. But we obviously that doesn't happen. No? So in Chinese medicine, we always try to achieve a balance. Okay? So when we say yang deficiency, okay, I think from the, we call this the tower diagram. Ikita nyo. Hmm. Yang is deficient. So the patient, what does the patient feel here? Does the patient feel cold or does the patient feel hot? When yang is deficient, kulang yung yang.
Cold.
Cold?
Cold.
Very good. Yeah. And if there is yang excess, so when you say excess, this is, if you consider this to be the boundary, no? Sumobra. Hmm? So may nababawasan. Okay? So when there's too much yang, the yin is affected. Okay? Nauubos si yin. Kung titingnan nyo, lumagpas na siya. Oh. So heat sure is heat excess or yang excess. Okay? So how do we treat this? You don't only reduce the yang, you also tonify the yin. Can you follow? So sa yang deficiency, you don't have to do anything about the yin kasi nasa normal siya. But the patient feels cold mainly because kulang yung yang. Okay? Next, yin deficiency. Look at this. So pag kulang sa yin, the yin is unable to control, no, I'm sorry. Kulang lang ng yin. So pag kulang sa yin, medyo tuyo. Kulang ng substance. No? So in Chinese medicine, like if you are very good now at tongue diagnosis, I want all of you to remember this. Our tongue has a thin white coating. What does a thin white coating mean? You can actually see the tongue body through the coating. Translucent siya. No? So if there is no more coating, that is yin deficiency. Are we clear? Okay. So pag yin deficiency, kulang ng yin, pero walang problema yung yang. Okay? So this is heat deficiency. Okay? Now when you say or empty heat, can you follow? The patient feels hot because the yin is deficient. But take note, initially the tongue will not, of course pag may heat dapat red. Initially, pag may yin deficiency yung pasyente, hindi kaagad pupula yung tongue. Wala lang coating. It takes several years for the tongue to turn red para magkaroon nito, heat deficiency. Okay? So mainit din. Ang difference lang dito, ito, heat excess, ito, heat deficiency. I know you will be confused when you say heat deficiency, but we'd rather use empty heat. Can you follow? So ibig sabihin, yung pasyente may heat dahil kulang sa yin. Okay? Ito, sobra sa yang. Dito, walang problema sa yang. Ang yin lang nagkulang. Since hindi na correct,
ulit yung empty heat na ano.
Opo.
Alin dyan, sir?
Ito po, heat deficient, itong empty heat, no? Yin
Okay.
deficiency. Yes.
Okay. Heat siya dahil walang heat. Okay.
Yes. And then as early as now, I want all of you to be familiar with the pulse. Okay. Okay, common sense. If the pulse is fast, what does it mean? Hot or cold?
Hot.
Okay, ang tanong ngayon, how are you going to differentiate yang excess from empty heat?
Paano yun?
Anyone? Kasi parehong mabilis no?
Strength ng pulse, parang sa quality ng pulse.
Yung young excess and empty heat po, bago po yung magkaroon ng empty heat, magsosobra muna po siya sa init po.
Okay, una-una, we are in agreement.
Ganun sound
May heat, mabilis yung pulse, di ba? So usually umaabot ng, by the way, mamaya matutunan natin kung, next time pala. Okay, basta mabilis yung pulse, may heat. Ang tanong ko, through the pulse, how will you know if the heat is due to excess heat, just like this one, or the heat is due to empty heat, or due to yin deficiency?
Pag excess doc, superficial. Pag empty heat, deep siya.
Okay, ganito. Sige, okay lang. Pag excess po, lahat ng levels, mabilis. You can find the pulse on all levels. If we are going to talk about, like, I hope we will have, some of you will have the chance to attend tomorrow or on Friday or Saturday because we'll be focusing on the pulse, no? So Chinese medicine, when you feel the pulses, we use 3 levels. Yung pinakaunang level is yung superficial. Parang butterfly lang, nakakadapo lang ganyan. No? Ilagay nyo yung pulso, yung ano nyo, yung mga daliri nyo. We usually use the pads. It's between the tip and the here. So dapat nandito. Okay. Sa Chinese, we use all 3. Later ko nasabihin kung saan. Basta kung ano yung pupulsoan nyo dyan. 3 yan. So pag nakaganon lang, parang butterfly, dapat walang pulso yan. No? Now, and then, ang pinaka-ideal talaga is yung nasa gitna, middle level. And then yung pinakamalalim, which is not also normal, is the deep level. Pag may excess heat ang pasyente, lahat ng levels, superficial, middle, and deep, mabilis. Kaya nga excess Kung nakikita nyo, lumagpas na po siya sa boundary. Okay, yung yin deficiency, empty heat na lang or deficient heat, no? Yung pulso niya mababaw lang. Sa taas lang. Empty Empty, wala. Pero nararamdaman yung pulso niya pag andun lang superficial. So pag diin mo, nawawala na yung pulse. Are we clear?
Yes, ma'am.
And also,
Baliktad.
Yes.
say deficiency, the pulse is not strong. Mahina, ano siya, medyo weak siya. Hindi siya sumisipa. No? So imagine,
Yin deficiency po yan.
opo, pag excess po, yung pulse ninyo is ano ba, parang sinisipa ka. Parang ginaganon yung daliri mo. Okay? And this is very important, especially in diagnosis. Kasi, first and foremost, you need to know, ano ba yung condition ng pasyente? Excess ba or deficient? No? Although there are other clues that we have to look for. Like for example, if the condition of the patient is excess, pag nagpapamasahe yan, ayaw niyang pahawak yung area. Gusto nila puro lang light massage, no? And ang lakas ng boses nila. Masyado silang agitated. So these are the things that you have. But again, you need to always check the pulse. Now, yung deficient naman, gusto-gusto nila ng deep tissue massage. Are we clear? Kasi nga kulang. Gusto nila ng pressure. So, yung mga nagmamassage dyan, at least now you know, even when you're into occupational medicine, you deal with the patients, no? You will only know na may nangyaring maganda sa patient if an excess pulse becomes normal. Do you follow?
Yes, Doc.
And the same thing for deficiency. Pag deficiency, kung usually hindi mo nararamdaman yung parang ang hina, ang bagal-bagal, no? Parang masyadong bading na bading yung pulse. So, lumalakas siya, but not too much. Are you excited? Okay.
Yes,
Doc.
So, in fact, another thing is when you look at the coating of the coating of the tongue will actually tell you the chronicity of the problem, no? So, normally, di ba sinabi ko kanina, ang normal na coating is thin white coating. Thin white coating. Baka mabangga si Dr. Kua, oh. Pero, pag yung coating biglang kumapal, no? Isang senyales yan na matagal na yung problema niya at saka malalim na. So, how are we going to monitor the progress of the patient? Numinipis po yung coating. Of course, that doesn't happen overnight. Kasi pag kinabukasan wala ng coating, ibang usapan na yon. Medyo hindi maganda ang mangyayari. Okay? So kung walang coating, kailangan nagkakaroon ng coating. Kung walang coating ngayon, kinabukasan ang kapal na ng coating, again, that's a serious problem. Okay? So now, we will not be showing you a lot of tongues kasi baka doon na kayo mag-focus. Let's also try to, okay? So when we look at the body, no, top half from the diaphragm tends to be more yang and below is yin. I think you already know this. So earlier, we have to discuss lengthily excess and deficiency. Are you excited? So a very good clinician will always see an impact in the pulse. And I'm excited to share with you what we have been doing. I think we're the only group that has been doing, ay nako, you have to stock up on intradermal needles. I have a very, okay, mamaya na. Kasi nagustuhan din nun ni isang ophthalmologist. She was complaining of peripheral neuropathy. She was receiving chemo for her cancer and she saw results. Sabi ko, which is better? The one that we used, like we had to needle your back. Sabi niya, mas maganda to mas dramatic. Okay? Excited? Yeah. Okay. Okay, let's continue, Ma'am Mercy. Sorry for interrupting. Okay, I think this is very easy. Let's talk about the sun. Okay, alam ko medyo parang ano pang hinihingi dito. Okay. So since yin and yang ito, sino po yung yang or yin component ng sun? Ma'am Mercy, are we good? Naku, parang hindi siya gumagalaw. Okay. Sige, tuloy na lang natin. Then after this, hina niya, no? Last time pa yan. Sige, tuloy ko na lang, ha? So we always compare the sun to the moon. And there is no such thing as puro, di ba kahit mainit na mainit, meron ding mga shade, di ba? Can you imagine, wala tayong puno, no? The same thing with the moon. May light din siya. So meron ding yang kahit moon. Okay? Now let's talk about, yin and yang organs. Nawala na tuluyan si Okay. Don't worry. Would you like to continue, Sir Mark?
Okay po. Yin
Yeah.
and yang organ, heart, lungs, spleen, liver, and kidney.
Okay. Pag sinabi nating yin organs, these are solid organs. No? Lung, spleen, heart, kidney, pericardium, liver. Tapos, meron din silang yang na partner. No? Now, ang partner ni lung na yang is large intestine. Si spleen, ang partner niya stomach. Hmm? Si heart, partner niya small intestine. Kidney, urinary bladder. Pericardium is sanjiao. Liver, gallbladder. Sa ngayon, yan muna memorize natin. Later, we're going to discuss why that is so. Okay, Sir Mark, can you tell us the yin-yang diagnostic categories? Ano yung basehan natin para i-differentiate ang mga diagnosis natin?
Yin and Yang diagnostics categories. Day, light sun, summer, heat, fire, active stress, and chi.
Okay.
Color, tangibility, and speed.
So the categories are temperature, hot or cold, moisture. Ano ba yung moisture? Okay, ay, andito na si Ma'am Mercy. Wet and dry, right?
Yes po.
Activity. Activity, Sir Mark, tuloy mo.
Excess or deficiency,
Activity.
activity, color, firmness, tangibility, and speed.
Sige, basta ganun na. Okay, maraming salamat. Okay, let's go back to Ma'am Mercy. I hope your signal is better now. Let's talk about yin in diagnostic terms. So you can give us as many as possible, please. Alam ko kulang.
Yun. Chronic, yun. Chronic, yun. Gradual onset, slow change, cold, stillness, building up, bonding up, cool limbs and body, pale coloring, quiet, no thirst, preference for warm drinks, frequent, copious urination, shallow breathing, diarrhea, pale tongue, white tongue, empty, shallow pulse.
Okay.
Uh,
Did
yung
everybody
lung-
get this? So pag chronic na yung problem, usually yin na yan. So, ibig sabihin, yung mga medyo maedad na, matagal na yung problema, yin yan. Yung mga medyo bata-bata pa, yun yung opposite. Okay? Okay, let's continue with yang.
Yeah.
So, yang is the opposite.
Yeah.
Hmm.
Yun. Acute or rapid onset, rapid change, heat, restlessness, discarding of clothing, hot limbs and body, red coloring, loud and talkative, thirst, preference for cold drinks, scanty urination, loud breathing, constipation, red tongue, yellow tongue, food, urgent, rapid pulse.
Okay, so if you see all these signs, all these symptoms, all these manifestations, then definitely you have a young patient. Y-A-N-G. Let's continue with 4 seasonal variations of yin and yang.
There. Oh, there. The spring again, the summer, the autumn, the winter. So,
Okay. Spring is represented by the liver, no? A very good analogy here would be yung nanganganak, giving birth. Di ba napansin nyo yung bata, yung ano to, yung newborn lumalabas, may meconium stain, kulay niyang green. Diba? And
Dok,
liver,
pwede din ba yung sprouts?
yeah, sprout, yeah. Exercise generosity is spring. So pag mapagbigay ka, there's a lot of positivity, whatever. Summer naman, okay, the next stage, let's go back to yung bata, no? Di ba pagdating nila ng toddler stage, I'm sure you've had children, yung pinakakula, kikita mo yung mukha nila mapula, di ba? Okay, so nasa heart na tayo, nasa fire na tayo. Okay? flowering and bearing fruit. Okay, then lungs, nourishing and parang nagdadalaga, papunta na ng puberty. Then lungs naman, autumn. Okay, ito yung nasa ano na, medyo patanda na, mga 40. Okay, so medyo iba na yung kulay. Medyo napansin nyo, hindi na siya pula, hindi na siya rosy cheeks. Parang puti na. And then winter, okay, umiitim na. Kaya pag may nakikita kayo nagda-dialysis, di ba, medyo marami na ka ng marks na maitim nakikita. Okay? So just read through this. Okay. Ma'am Mercy, what is the complexion of someone with yin deficiency?
The complexion is pale or sallow complexion, dryness and dullness, redness or dark circles around the eyes. It's may premature aging siya.
Okay. Ideally, may mga itim-itim ka makikita. And that represents the kidney. And by the way, the kidney kasi is the root of yin. No? So pag nagkulang ka ng yin, may mga itim ka na makikita. Are we good? So yin deficiency complexion is look for black things there, black whatever, because the kidney is already affected. Okay, ano naman ang face na may yin deficiency? Again, think of the kidney.
Dark grayish po siya.
Okay. May swelling under the eyes. Di ba napansin nyo yung dito? Oo. Basta
Eye
always
bags.
yeah, eye bags. Sa atin, kidney yin deficiency. Yeah. Swelling under the eyes. Why? Nag-retain na ng water. Hindi na makapag-eliminate ng water. Hindi na siya na makapag-balance. Okay? So again, yung mga itim-itim na kidney yan eh. What about the ears? Okay, if you look at the ears, how will you know pag may yin deficiency?
Ears, ano siya, thin at saka yung dry, yung mismong auricle niya.
Actually,
May
dark siya, withered, parang nalanta.
okay.
Pero wag niyo naman sabihin, oy, nalalanta na po yung earlobe niyo. O tingnan mabuti yung mga earlobe. Pagkatapos merong ringing in the ears. Yeah. So that's yin deficiency. Are we good? Excited? So when you
Yes,
look at the ear, ay, parang naguluntoy na yung kanyang earlobe. Earlobe Earlobe. Sa earlobe, ingatan nyo. Nandyan yung ating muka. And by the way, if you attend tomorrow, ay mamaya pala. Mamaya ha, meron tayong mga bonus. Kaya you have to really attend to the end. Don't worry, we will end before 9. You have to take down the notes. This is based on experience. Meron ako na-discover 5 points dito sa earlobe that will really, really make your patient feel happy.
Oh,
Yes.
interesting.
Hanapin mo yung yung jaw or mandible, then hanapin mo yung cheek, no? And then the eyes, the forehead, and the temples. And then use intradermal needle. We're the only group that, well, to be honest, this is a discovery, and they love it. Yeah. Oh, how will you know na ang ngipin niya may yin deficiency? So when you, yeah.
Yung na-research ko dito daw sabi dry eh.
Yeah,
Dry
dry.
yung teeth.
Yeah, dry. Okay, kung inong teeth. Or ubos na yung teeth. Okay, body, yin deficiency. May kilala akong ganyan. Ay,
Ano?
masya.
Yin deficiency.
Buti na lang wala. Okay.
Skinny.
Wala siya
Ano yung
dito,
yin
Doc, ngayon.
deficiency na body?
Skinny. Payat siya, sir.
Skinny.
Malnourished.
Yes. Huwag naman malnourished ka agad. Judgmental naman. Okay. Skinny lang. Then, okay, yin deficiency tang. Sinabi ko nung to kanina.
red without coating, cracks on the tongue, tapos soft with
Thin.
difficulty in motion. Yun,
Nipis. No coding. Parang wala,
No code.
knowledge siya. Think of yin deficiency as kulang sa nutrition. Okay? Kulang sa...
Yun nga po.
The time, your knowledge on supplementation comes in very handy. Okay? Yin deficiency.
Yes.
Red, short, cracks, dry. Okay. Temperature, yin deficiency.
Feeling like heat radiating from inside the bones. Parang, yun, hot flashes.
Nakaka-relate ba?
Parang feverish siya. Hindi pa, Doc. Feverish, pero hindi talaga yung lagnat na lagnat.
Yun yung temperature, hot flashes. No? Mainit din yung ano nila, itong yung palm,
Yung mga limbs
yung
sa
soles, yeah,
ay,
also the center of the chest, yeah. Maraming salamat, Ma'am Mercy. Let's call now on Doc She, who is very excited. Okay,
Yeah.
how would you characterize sleep that is yin deficient? So that is why if you are entertaining, may yin deficiency itong pasyente na to. So this is what you will ask.
Yes.
Yes, what do you ask?
Do you have a disturbed sleep, or do you have a insomnia?
Yes. Mhm.
Mm.
What else? They sweat at night.
Sweat.
They sweat at night.
Night sweating.
Kulang kasi sa yin eh. Kasi pagdating ng gabi, tumatago na yung chi, yung wei chi mo. Eh ngayon, kulang nga. Kailangan din ng ano, kaya nagpapawis sila. Emotions na may yin deficiency.
They are sorrowful, sad, and fearful. Fear, sorrow, and sadness.
Irritability.
Irritability. Ano ba?
Kasi mainit ang pakiramdam. Okay, sound. Yin deficiency sounds.
Sounds soft.
Ringing in the
Wala
ear.
akong sagot
right?
dyan.
Maingay noisy.
Ringing.
Gradual loss of voice. Nauubos
Mm.
na yung boses dahan-dahan. Weak breathing, mahina na yung paghinga. And dry cough. Lahat dry. So, lung yin deficiency. Excited? Yeah? Okay, so tatanungin mo, meron ka ba naririnig? And then nakita mo mukhang yin deficiency talaga, no? Tapos yung boses niya nawawala na, dahan-dahan. Weak yung breathing. Yung cough niya dry. No? What is yin deficiency often associated with? Yung mga nakaka-relate ang iba.
Ano ba ito?
Yung talagang dinadaanan na lahat ng mga babae. Menopause.
Menopause. Wala akong sagot dyan. Insufficient
Oh my.
moisture.
Yeah.
Blood stasis.
Okay, next. This is also very helpful. Name the organs affected by yin deficiency.
The heart, lungs, spleen, liver, and the kidney.
Are you sure with the spleen? Sa spleen,
Hindi
more
ko
on
kasama.
yang deficiency ang spleen.
Oh.
Okay?
So, mali yung source ko.
Pwede din siguro, pero mas common kasi, siguro naman, this is based on incidence. Karamihan kasi sa may spleen issue, may yang deficiency, hindi yin deficiency. Although, there is such thing as spleen yin deficiency, but again, more common yung yang deficiency ng spleen. Okay? Kaya nagkakaroon ng dampness karamihan. So, these are the 4 organs. Of course, we are referring to the yin organs. Kasi deficient yung yin. So, ito na iisipin mo. Pag yung kidney talaga affected na, lahat na yan affected. Affected na si liver, si heart, pati si lungs. Okay? So on the tongue, we'll do Yes.
Doc, bakit wala po sa
Spleen.
spleen?
Yung spleen kasi ang organ sa sa youth, sa pagkabata lang sa active
Oh, yes.
in the
Yeah.
medical world.
Yes.
Sa Western, ano. Wala
Okay.
sa masyadong use sa adult life.
Yeah, that's a
Kaya
good one.
siguro.
Opo.
Okay.
Ano ko lang yun. Speculation ko lang.
Maraming salamat,
Mm.
Dr. Kua.
Mm.
Yes.
At least,
Oo. Actually, ang spleen sa Western medicine, it's supposed to be the graveyard ng worn out red blood cells. Doon tayo nagre-replenish ng blood cells. So sa Chinese naman, doon din tayo parang ganun din, 'di ba? Doon kaya hindi siya common na maging yin deficient. But instead nagiging yang deficient siya. Okay? So I hope everybody remembers this. If you have a diagnosis of yin deficiency, you have to be very specific anong organ ang affected. Okay? Later on, pag heart ang affected, there is always palpitations. Okay? Heart, any heart pattern, there is always palpitations. And you have to actually describe ano yung palpitations. Kasi you're not supposed to hear your heartbeat. Kaya mabilis yan or mabagal, that's still palpitation. You're not supposed to hear it. So, lung yin deficiency, usually cough, na ano natin kanina. And pag tinignan mo yung dila, meron kang makikitang parang dalawang at saka malalim yung area ng lung. No? So we would like you to actually look at the tongue geography, tongue topography. Liver, yes. Oo, kaya nagkukulang ang yin ng liver, kaya may tendency maging liver yang rising. Do you follow? Because if the yin of the liver is so kulang, so deficient, it cannot control the yang. So, ang lalabas, yang, liver yang excess or liver yang rising. Lalo na pag sumasakit ang ulo. No? Or emotional stress. Number one is liver yang rising. And merong cause yan. Any questions before we continue? So punta na tayo dito. These are the things that you have to remember because all throughout your journey, you will be mentioning this. What are the signs and symptoms of yin deficiency? Again, I think everyone is aware that ano ang difference ng sign sa symptom. Sign is something that you can see. Symptom is what is felt by the patient. Okay? So what are the
Yes.
signs and symptoms of yin deficiency, Ma'am She?
The signs of yin deficiency is pale.
No,
Ay, ano pa to? Ano ba?
it's okay.
Ang nakalagay lang kasi sa akin dito, Doc, is palpitations, thirst,
No, that's very
insomnia.
specific. This is
Okay.
general signs and symptoms.
Mm.
Ibig sabihin, this is
Ito na.
found in
After.
all. Kidney, heart, yin, lung, or liver.
Dry
No?
mouth.
Afternoon fever, the patient will tell you, why do I feel hot pagdating ng hapon? No? Actually, it starts at 3 p.m. Malar flush, nagkakaroon ka ng dito. And then restlessness, hindi ka mapakali, night sweats, 5-pound heat, although we only have 2 pounds, but that actually refers to the soles as well and the center of the chest. Hawakan mo doon, mainit. And dry mouth. Okay? Dry mouth. Next, what is the pulse associated with yin deficiency?
Thready, wiry,
rapid
rapid pulse. Rapid pulse.
Yeah, thready or thin, no? But it is distinct. So ibig sabihin na nararamdaman mo siya, very obvious siya. And it's rapid, no? Floating, ito na yung sinabi ko kanina, distinct with very light pressure. And empty, like a big soft balloon partly filled with water. Imagine nyo, malaking balloon na may parang parang kahoy na naka-float sa tubig. Okay? Yun yung mararamdaman mo sa pulse niya. So, nawawala siya pag diniinan mo. Empty nga siya eh. So, what is the tongue? Describe the tongue body in yin deficiency.
The tongue is thin
Mhm.
without a coating.
Yes. Thin or no coating. Mhm. And red. If meron ng empty heat. Okay? Usually, magko-complain lang naman yung pasyente pag red na yung tongue eh. Oo. Kasi mainit na yung pakiramdam nila. So, um, wala namang symptoms masyado pag walang coating lang. Okay, punta na tayo naman sa kidney yin deficiency.
Um, the the qualities of kidney deficiency are hot flashes, sweating while sleeping, scanty urine, weight loss.
Okay, very good. Okay, if you notice, pag kidney yin deficient na, marami ng organs affected. And remember, kidney is a water element, no? So, mamaya, tatadta rin namin kayo ng 5 elements. Okay? So, I hope you can join us at 7. So, dry mouth at night. So, ibig sabihin, yung water mo kulang na. Hmm? Hmm. And kahit tuyo yung bunganga mo, yung paggabi, you don't drink much. Actually, sips lang. Hmm? That's kidney yin deficiency. And also night sweats. What are the qualities of liver yin deficiency? Actually, there's only one. Kasi pag sinabi mong liver yin deficiency, you have to mention also the symptoms that we discussed earlier. But again, there is one very important symptom that will tell you that it is really the liver yin that is deficient. And what is that?
Blurred vision,
Dry eyes.
dry eyes.
Ang blurred vision is liver blood
Um,
deficiency. Okay?
okay. Dry eyes, dryness in the eyes.
Yes.
Mm.
So, there. Yeah. So, di ba dry mouth at night, it's kidney yin deficiency,
Mhm.
night sweats.
Eyes.
Liver yin deficiency, dry eyes.
Okay.
So, how are you going to treat this? You have to tonify the liver yin. Meron tayong tonification point for the liver, but that is not our agenda for now. Now, what are the qualities of heart yin deficiency?
Insomnia, irritability, palpitations, night sweats.
Actually, you'll have insomnia kahit liver, kahit ibang yin deficiency.
Mhm.
But again, we want something that's very specific for the heart. So as I mentioned earlier, there will always be palpitations and mental restlessness. Bakit may mental restlessness? Because yung shen, yung mind natin, which is very subtle, the spirit, we call it, nakadepende po yan sa heart yin or heart blood. Okay? Pag kulang ka sa heart yin, heart blood, walang residence yung shen mo. Kaya nagiging restless ka. Hmm? Hindi ka mapakali. Mental restlessness. And when you look at the tip of the tongue, the tip, remember, is the heart, right? It is redder, and you will see red points. Red points on the tip. No, actually, hindi lang sa tip eh. Kahit sa sides. Okay? So, yon. Palpitations. So, pag nakita mo yung tongue, syempre, pag tingin,
Lab, dalhin mo tong
okay, yon. What are the qualities of lung yin deficiency?
lung yin deficiency has dry, hacking cough,
Yes.
thirst, and dryness of the nose and mouth.
Okay. You can also have blood-tinged sputum and feeling of heat in the afternoon. Actually, pinaganda lang natin yung pangalan. Actually, TB ito.
Okay.
Yung nga sasabihin ko, Doc, TB yung
Opo, Doc, yes. So now, parang hindi naman
Unite.
Oo, madali lang naman gamutin. Pero napaka-endemic kasi ang TB sa atin eh. So, sanay na tayo dyan. Ang maganda, para mawala yung side effects kasi matagal yung gamutan niyan, no? 6 months? Yeah. So you need to mitigate the side effects. So we hope that we can work closely with uh, I think the respiratory therapists, no? And also the pulmonologists. Okay? Yun. Di mo naman pwedeng hindi bigyan ng ng gamot yan. TB kaya yan. Kaya medyo ingat-ingat na pag may lumalabas na ano. Okay. And by the way, no?
Color T.
Okay, I have something to share lang with you, no? Kasi there are some, they don't actually do sputum exam. So sometimes uh, they would presume na TB, but in reality, it's cancer. Alam nyo ba sa X-ray, parang pareho lang yung first stage although hindi mo man talaga makikita, parang mukhang yung lung cancer sa TB. No? So, yung iba kasi parang they will presume this is TB, pero wala namang sputum exam. Yung pala
Kaya
cancer.
silang mga payat.
Yes. Oo. I should know that because that happened to my mom. Okay. Binigyan siya ng medication. At sabi, pag TB ka, kukunti lang naman kami sa bahay. So yun. Pero there are other causes why you get cancer of the lung. And remember, saka lang nagiging concern yan pag stage 4 na. And I haven't heard of anyone surviving from stage 4. Okay? So, I hope we can be more responsible, no? So if we can, through the help of Dr. Kua, who is more in touch with patients, kaya dapat mabait tayo kay Dr. Kua, siya ang mangunguna dyan. Saka mas kapani-paniwala siya kasi yung apelyido niya mas credible. Okay. So we will try our best to make our TCM more exciting, more interesting, so that we can help more people. Okay? Now, let's go to, okay, ito naman. Ang stomach kasi po, no? It's a yang organ. But again, it can also be yin deficient. Okay? And so, kanina, yung question natin is yung mga yin organs na usually affected by yin deficiency. This time, we have a yang organ sa stomach. So, ibig sabihin, di ba partner ito ni spleen? Sabi nga ni Dr. Kua kanina, kaya naman hindi na-discuss kasi medyo takes a while para mag-mature, di ba? So, yung ating dito, yung stomach. And take note, when you talk about coating, no? Coating of the tongue, it's actually the young organs. So if it's in the center of the tongue, walang coating, that's yin deficiency of the stomach. So ang question po dito is, ano naman yung symptom dito? Or sign?
Constipation, Doc.
No.
Epigastric. Bakit baliktad
Epigastric.
yun?
Epigastric pain. So you should know where your epigastrium is. Okay, so, and then when you look at the tongue, it's red. Not all the time, but usually makikita mo yung center. May pinakita ako last time sa group chat natin. Ang galing nyo ha. Sino ba yung nagsabi may epigastric pain? Hindi ko pa sinasabi. Diba?
Si Mark.
Si Mark, oh. Okay, what are the organs associated? Okay, yang deficiency naman tayo.
The organs associated with yang deficiency are the small intestine, large intestine, gallbladder, urinary bladder, and the stomach.
Okay, remember
Ay,
this
bakit
is
may
like
spleen pa?
pwedeng yin organ or yang organ. No, I did not say okay. Actually, marami tayong mysteries dito kasi syempre pag sinabi mong yang deficiency, but in reality, it's the yin organ. Sounds weird, no? But that's true. Like kidney yang deficiency. Ito yung malamig yung paa, you know, pagdating ng 2 a.m., 3 a.m., talagang nalalamig na, no? Yon. That's kidney yang deficiency. And when you look at their tongue, it's not red, obviously. It's going to be very pale and wet or moist. Okay? Yan ang distinction natin sa yin deficiency from yang deficiency. So, yang deficiency, kidney yang. Okay, and also, pag may kidney yang deficiency, meron ka ring spleen yang deficiency. Why? Kasi yung motivating force ng spleen is the kidney yang. Okay? Kaya, for the spleen to perform its function, it needs the fuel coming from the kidney. Eh ngayon, yung kidney mo kulang sa yang. So affected din yung spleen mo. Kaya kakaroon ka ng dampness. And meron tayong tinatawag na cockscrow diarrhea. At 5 a.m. or even earlier sometimes, nag-LBM sila, no? So that alone is already telling us that the kidney is affected. Heart yang deficiency. Ito yung mga kasi kidney and heart, they work always together. Fire and water yan eh. Water ang kidney, fire ang heart, no? And ito yung mga taong madaling magulat, naglalamig yung kamay, and of course, maputla yung kanilang dila, no? Oo. So, pag mahaba yung dila tapos mapula, hindi yan yang deficiency of the heart. Okay, punta naman tayo sa yang deficiency. So we hope that this kind of lecture will make you really fully grasp the importance of knowing the yin and yang. Okay. Ma'am She.
The symptoms of yang deficiency are fatigue, cold extremities, diarrhea, and edema.
Okay. To be more
Cold lips.
in general, yang deficiency is an aggravation of qi deficiency. Pag sinabi nating qi deficiency, the functioning of the particular organ is hindi optimum level, no? So qi deficiency, kulang na siya ng energy. But this time it is more severe. So ibig sabihin, pag sinabi mong yang deficiency, it is an advanced stage of qi deficiency. Okay? And there are signs of cold. No? So, it's actually qi deficiency, pero yun nga lang, mas malala. So, pag hinawakan mo yung kamay, yung katawan niya, at saka feeling niya talaga malamig, that's already yang deficiency. Of course, there will be chills, cold lips, aversion to cold. Okay, ano yung pulse quality associated with yang deficiency?
Pulse is deep, weak, and slow.
Very good. Or sinking. O, diba? Parang nahihiya, nakatago. Tongue body associated with yang deficiency.
Tongue body is pale with teeth marks,
Okay.
wet or shiny, moist, white coating.
Okay. Pale and flabby. Yeah. Okay. Shu is deficiency. Okay. The question is, what are the symptoms of heart yang deficiency? So obviously, meron tayong palpitations dito. Okay.
Chest pains and cold extremities. Mm-mm.
O merong feeling of discomfort or stuffiness in the heart region, feeling of cold, o naka-capitalize siya na, bright, pale face. Pag yang deficiency, bright na bright yung mukha niya pero maputla. Pero the lips are slightly dark, sometimes cyanotic. No? Cold limbs, especially the hands. So when you shake the hands of your patient, ang lamig-lamig, ma-idea ka na. Baka heart or lungs, dalawa lang yan. No? Chills, cyanosis of the lips. That's heart yang deficiency. Feeling of cold lang. Ha? Pero hindi pa malamig yung pwede na pala malamig na rin. Okay. Okay, ano naman ang tongue and pulse sa heart yang deficiency?
For the heart-yang deficiency, tongue and pulse, the tongue is pale or purple with white and moist coating,
Swallow.
and the pulse is very deep, slow, and very weak.
Okay, in severe cases. Steady, weak, tapos misty. Minsan parang feeling mo, bakit parang nawawala? Choppy, no?
Mhm.
Okay, let's go.
Marami akong naka-experience yan, Dok, na pulse.
Yeah.
Yan.
Alam mong ibalik yan pag alam mo yung technique, no? Using only the ear. Heart, yang, collapse symptoms.
For the heart-yang collapse symptoms, loss of consciousness, shortness of breath, and heavy sweating.
Okay. Or comatose na pag severe, no?
Ito.
And this is basically heart chi deficiency plus yang deficiency. Hmm?
Mm.
Mm. Ay, yung kanina pala, sorry ha. Yang deficiency na pala to, kaya cold sa dapat. My bad, ha? Nasa utak ko kasi heart chi deficiency. Kaya dapat cold siya. Pag yang deficiency, cold talaga. So this is heart yang collapse. This is basically heart chi deficiency plus yang deficiency plus palpitation, shortness of breath, ito profuse sweating, cold limbs, cyanosis. Actually, kailangan na talaga, actually ano pa lang, basta any heart issue, mag-refer na po tayo sa cardio. Okay? Maraming salamat, Doc She. Thank you so much. Let's now call on Miss Ormoc, who seems very ready. Miss Ormoc? Yeah. Okay, nakita ko na si Sir Walter. Mukhang ready-ready na rin sumagot. Sir Walter, are you there? Alam ko may signal pa kayo. Ayan.
Yes po, medyo choppy lang po, Doc. Good
Oo,
evening
mukhang
po
hindi
sa lahat.
naman. 61 to 80. Ready na po kayo, 61 to 80. Ay, sino
Sige
itong
po, Doc.
sit-in? Okay. Okay, meron palang pangarang sit-in. Oo, so yon. Okay. Next, Ma'am Vangeline. Okay. Ano po yung tongue and pulse picture ng heart-yang collapse? Isipin nyo na comatose na, ha? Tongue and pulse.
Kulay pink.
Yes?
Weak pulse.
Ay, bakit iba sumasagot? Wait na. Kayo mamaya, Sir Mark. 81 to 100. Okay. Ma'am Vangeline, please. What's your answer here?
So, kanang deep and weak and very pale.
Bakit parang nasa ano ka? Nasa West China Sea.
Ano ba yon? Medyo hindi ko nga po alam paano tudok eh.
Ay, tanggalin mo na lang
Volume.
siya. Tanggalin
Yan.
mo na lang. O, ganyan. Okay na. Sige, go. Sige,
Ano
tongue
to?
and pulse.
Tongue, for the tongue, dog, pale,
Tapos yung pulse, pulse.
deep and weak.
Okay, bluish purple, short. Pwedeng short yung tongue. Actually, bumabalik. Okay, hidden, minute, knotted, feeble, fading. Okay, let's go now to spleen, yang deficiency. Ano po yung signs and symptoms?
Poor appetite, fullness, and sleepiness after eating. Fatigue, weight loss, loose stools.
This is yang deficiency, ha? Mas malala sa qi deficiency. So alam na natin yan, qi deficiency signs plus okay, desire to lie down and curl up kasi nalalamig. Okay? Feeling cold. Alam nyo na to, abdominal distension, worse after eating. Umuusli na yung tiyan pagkatapos kumain. Okay? They prefer warmth and pressure. Kaya pag nagpamasahe ito, gusto nila deep. Next, tongue and pulse ng spleen yang deficiency. Tanggalin mo na yung ano mo. Yes?
Tongue and pulse.
I think mas klaro yung boses mo pag walang headset.
Ano kasi Dok nasa CPU po ako.
Nasa
Kasi CPU.
CPU.
So, pag
O sige, ano sagot
Malakas
mo
sound.
dito? Sige, sumigaw ka na lang.
Dok,
Speak as loud as you can. Sige po. Okay, the question is, ano ang tongue and pulse sa spleen-yang deficiency? Remember, malamig yung feeling niya.
ano Dok, deep, weak, slow, deep. Dok.
Okay. Yes. Now let's go to kidney-yang deficiency. This is also very common, especially sa mga may fertility issues. Okay, let's go. What are the symptoms ng kidney-yang deficiency? Go.
Pain with pain in the lower back and knees, cold body and extremities, diarrhea, especially in the early morning, then edema in the body and extremities, lower
Okay.
lower libido, impotence, and then miscarriage in women, then premature ejaculation in men.
Okay, and also impotence, low sperm count. So kung meron kayong mga pasyente ganito, so pwede natin tulungan, although you don't have to promise anything. Okay, so that's kidney-yang deficiency po. And for women, infertility. So pag na-correct nyo yon, okay na tayo. Now, tongue and pulse po ng kidney-yang deficiency.
Ano
Yes?
daw, pale tongue, slow, soft pulse, soft pulse, regular.
Okay. Now, let's go to kidney-yang deficiency, water overflowing symptoms. Water overflowing, nalilunod na. What did you get here?
Parang wala ako.
Ayo, hindi mali.
Yeah.
Oh, wow.
Okay. Actually, I'm sure si Dr. Kua mayroon mga ganitong cases na. No, we have a term for that. But for now, let's not talk about it yet. Ang importante, alam niyo po yung pathology sa Chinese. Okay? Fullness and distension of the abdomen. Nagdi-distend, scanty clear urination, edema of the legs and ankles. So they have kidney failure, cold feeling in the legs and back, soreness of low back, feeling of cold water. And so the heart is also affected. May palpitations, breathlessness, cold hands. And then pag may pulmonary edema, ginandala, water overflowing to the lung, thin, watery, frothy sputum, cough, asthma, and breathlessness on exertion. This is just to show you that konektado lahat ng organs natin. Okay? Tongue and pulse po, Ma'am Vengeline.
For the tongue, Doc, short, deep, weak, and slow. Pale,
Okay. Pale, swollen, and wet. Okay. Excess yin is what? Anong pagkakaintindi mo sa excess yin?
excess yin, Doc, ano siya? Sobrang yung coldness niya.
Okay. Excess, alam niyo na pag excess yung pulse, tapos makapal na yung coating, plus cold. Okay? Feel the pulse. The pulse are so matapang, plus cold. Next. Excess yin is also known as sige, okay lang. Yin, sure. Okay? Sure. I don't know if I pronounced it there. Sure.
Oh,
Sure, excess. Oo.
Sure, excess.
Nakakaya tanungin si Dr. Ku. Now, punta naman tayo sa excess yin emotions. What are the emotions associated with excess yin? Oh, ito. Do you have the answer?
Yes, Doc.
Ano, Doc? Lethargy, passivity, coldness, feeling of being stuck.
Okay, syempre pag yin, sobrang yin, may depression yan. So pag naayos mo yung excess yin niya, somehow makakatulong tayo, no? So we hope we are looking forward to maybe collaborating with the psychiatrists. Maybe they can learn from us, no? Wag mo lang kunin kasi di mo tayo psychiatrist. Apathy, pain, lack of motivation, frustration, feeling stuck, fear, overwhelmed. Now, you will be surprised, especially pag naalis mo na yung phlegm, yung yin niya, nag-i-improve yung pasyente. Okay, anong itsura ng tongue sa may excess yin, Ma'am Angeline?
Yung tongue, Doc, not too thick, pale red, slightly moist,
Anong
with
pale red?
supple shade.
Hindi siya, yeah, pale red. No, actually, when you say pale red, that's the normal color of the tongue, or pink. But pale is like, walang red. Putla lang talaga. Excess yin pulse. Ano po? How do you describe the excess yin pulse?
Excess impulse. May palpitation siya, Doc.
No,
Kasi
pulse.
di ba,
Slow. Cold na cold, di ba?
Apo.
Hmm.
So kung cold siya, Doc.
Okay. Ano naman ang itsura ng excess yin face and lips?
Pale, tapos
Pale. Done.
Mhm.
Pwede na, pale na. Okay.
wrinkled. Pwede ba yung wrinkled?
Okay. Anong feeling ng isang pasyente may excess yin?
Nangihina.
Na,
Nalalamig. May have chills.
alam.
Okay? Next. Excess yin likes what? Anong gusto-gusto ng mga pasyente na excess yin? So tatanungin mo, do you like this kind of drink? Ma'am
It's nasa warm.
Benjamin,
Ano po yun, Doc?
anong gusto ng mga pasyente? Like, anong klaseng drink ang gusto ng mga pasyente pag excess yin?
Doc,
Warm.
And
Warm.
then they are not thirsty. They are not very thirsty. Mm-mm.
Warm.
Ano yung nangyayari sa joints ng mga pasyente na may excess yin? What are the possible other symptoms that you can see, you can find?
Inflammation. Arthritis.
The joints are swollen,
Ano?
achy, no?
Mm.
Kaya nakikita nyo yung mga nadidepress, masasakit yung mga joints niya. Kailangan sa nadidepress. Sobra yung yin. Tingnan nyo yung mga tongue nila, ang kapal ng coating. Okay,
So
feeling
yung arthritis po pala.
yes. If the arthritis is due to dampness. Okay. And some people, they feel more depressed if it's pag winter. Kaya may mental disorder sa pag winter
Sa North
sa
po.
US. Oo.
Mm.
People with excess yin may be blank and have blank. Okay, from the book ito. Sige, di bale na. Overweight. Usually overweight.
Oh. Mm.
Kapag depressed, nagiging overweight, hindi kasi gumagalaw. And they have low metabolism. Excess yin may have pain. Anong klaseng pain ang mga pasyente na may excess yin?
Dull, pain.
Remember, excess.
Sobrang sakit niyan, Doc.
Pag nagpapamasahe sila, gusto ba nila ng hard o ng soft?
Hard.
Ayaw nila ng hard.
Ayaw nila ng hard kasi marami
Ayaw nila
silang
ng
yin.
hard. Worse with pressure.
Naririnig sila pagka may warm compress or
Yes,
mainit.
hot compress, warm compress. Very good. Remember, excess yin is cold. Okay, ano naman ang movement ng isang pasyente may excess yin? Mabilis ba sila kumilos, Ma'am Bancheline?
Slow.
Po, slow.
Minimal. Konti lang yung movement. Hindi sila gumagalaw. Ano naman appetite nila?
Lagi siya. Appetite. Poor appetite,
Malakas.
Doc.
Lowered. Di ba pag depressed ka, hindi ka naman malakas kumain. Maraming salamat, Ma'am Vangeline. Kahit hindi namin gusto yung audio mo, pero okay lang. Maraming salamat. Okay, punta naman tayo. It's okay. Try to fix that next time. Kasi mukhang nasa ano ka, nasa ibang dock. Okay, let's call on Sir Walter
Yes
Arevalo.
po. Good evening po.
Good evening. Sandali. Tatawagan natin si Sir Mark from 81 to 100. Pagkatapos si Ma'am Mavel. Akala mo Ma'am Mavel, hindi ko kayo nakita, no? 101 to 100 hanggang sa the end. Ma'am Mavel, yes. Sir,
Doc, tignan ko, Doc, nagda-drive pa po ako eh.
pakita mo daw. Joke. Okay. Sige, sinong ano? Sino ba itong si Sit-E? Okay. Si Ma'am Susan, kayo na aubusan niya.
Na lang po, Doc.
Baka kaya ni Mark lahat. Okay. Punta naman tayo kay Sir Walter. Okay. Excess yin may be experiencing. Ano yung possible na mga makikita mo sa isang pasyenteng maraming yin?
Edema, lethargy, and digestive issues po.
Okay, may makikita kang bukol-bukol, swelling, lumps, masses, and discharges. Okay? Hindi kasi gumagalaw eh. Oh. See? 62. Ano naman yung urine ng isang may excess yin?
Clear, frequent, or copious urination po.
Very good. Stool ng excess yin.
Watery, loose stools, or diarrhea.
Okay. Sticky, constipation. Treatment natin for excess yin. Ano yung treatment principle natin? Ano yung gagawin mo?
So, sa pag-excess siya is tonifying the yang and reducing dampness.
No. Tanggalin mo muna yung excess cold. Bawasan mo yung excess cold pati yung damp. No? Hindi mo na kailangan i-tonify yung yang. Automatic na yun mag-i-improve. Okay? Next, diet recommendations ng excess yin.
Avoid cold, raw food, prefer warm, cooked food to improve circulation and digestion.
Okay. Onset. Paano yung onset ng isang may excess yin?
Usually gradual po. And then often related to long-term exposure to cold, damp environment, or dietary habits po.
Okay, ang galing. Okay, let's go now to yang excess naman. How do you characterize it?
Yang excess is a state of overacting yang energy, resulting in symptoms such as heat, restlessness, fever, and agitation.
Okay, where is yang excess more common? Sa elderly or sa young patients?
Yung
Sa
patients.
ano po?
Bata.
Sa mas bata po sa.
Okay. Ano naman yung yin excess? Okay, binalik natin yung yin excess para makita niyo yung contrast. Can you tell us about it again?
So in yin excess, acute onset, short course, young age.
Okay.
Yun po.
So, ano napansin niyo dito? Pag excess, maikli lang siya. Short course siya talaga. Yin excess or yang excess. Kasi pagpunta natin sa deficiency, medyo chronic yon, medyo matagal yung gamutan. No? Punta naman tayo sa yang deficiency, Sir Walter.
Yang deficiency, the lack of warmth and energy in the body, leading to cold symptoms, fatigue, and weakness.
Okay. Saan siya mas common? Sa mga bata, sa mga matatanda?
Sa mga bata po.
Okay.
Mga
Alin ang mas madaling gamutin? Or saan ka mas masaya yung pasyente? Pag young excess or young deficiency?
Yung excess. Yung excess mo.
parang mas madali pag-excess.
Yes. So yun nga lang, mas malaki income na yung deficient joke. Pag pag medyo young deficiency, yung spacing mo ng treatment sa kanila, wag naman yung weekly. Pwedeng every 2 weeks, or you can start with once a week or twice. Tapos yung mga excess, pwedeng 3 times a week. Then, maikli lang, wag mo naman tagalan. No? Next. Yin deficiency, can you tell us more about it?
Insufficient fluids leading to dryness, heat, and lack of nourishment.
Okay. Can you discuss the signs or saan siya mas common, sa mga young or elderly?
Sa mga elder po.
Okay, now we know pag deficiency conditions sa mga matatanda,
Matanda.
tapos matagal yung gamutan. So yan yung usually nag-rehab, no? So medyo matagal. Tapos yung mga excess, madali lang. And mas dramatic yung improvement if you know how to do it. Okay? Yin is the blank for young. Grabe yung fill in the blanks, no?
Foundation
Oh
and
yes,
substance.
very good. Ang galing. Or material basis. Ito yung yang is the blank of yin.
Activity or functions.
Okay, functional manifestation. Very good. What are the functions of yin?
So the functions of yins are nourishing, moisten, and provide structures for the body.
And also cooling. No? What are the functions of yang?
So it gives warmth, move, transform, and provide activity to the body.
Okay. What does excess of yin imply? Anong nangyayari sa yang pag may excess ang yin? Is the yang affected?
Nagkakaroon ng coldness. Yes.
No. Ang tanong ko ganito, anong impact ng excess of yin sa yang? Nagiging deficient si yang.
Deficiency.
Okay. But if you reduce the yin, sometimes you don't need to tonify the yang. Automatic siya tataas. In extremely chronic conditions, what pathology exists with yin and yang? Sinabi ko na kanina yan.
Both yin and yang have deficiency can exist simultaneously, leading to a state of collapse.
Ang galing. Okay. Deficiency, pwede na. It is almost impossible to see a case of a deficiency simultaneously of both yin and yang. True or false? Or in other words, do you get to see both? Okay.
False, sir.
So, posibleng may deficiency, mayroong excess. So, ang tanong, anong una mong gagamutin? Yung excess o yung deficiency?
Yung excess, sir.
Sure ka?
Tanggalin ko muna yung excess, sir, para
chinek mo yan sa libro?
babawasan ko muna yung excess, sir, para
So, okay.
then yung deficiency improve po, sir.
Sige, mamaya na lang to sa treatment principle na to. Okay. True or false, it is almost impossible to see an excess simultaneously of both yin and yang. So, yin excess, yang excess. Posible ba yon? Or
Parang
imposible?
hindi pwedeng pareha silang excess.
Galing talaga. Okay, true. So, hindi pwede. Wow. In the case of deficiency of both yin and yang, to tonify either aspect will benefit the opposite aspect. True or false?
True, sir.
Yes. Kasi pag yun lang isa tinonify mo, may impact na yun sa ibang aspect. Next. Which of the following belongs to yin?
Male, small intestine,
Yin.
exterior liver.
Alin dito?
Yung liver, sir.
Yeah, wow. Okay, hanggang 90 ka na lang. Alam ko marami kang sagot. Okay. Which of the following belongs to yang?
The kidney, sir.
Chi.
Can you consider your answer again?
Which of the kidney, usually 6 p.m. to 6 a.m. ang treat, then winter
Wait lang. Apat itong
No.
choices, Okay. Ang kidney ba more young? Ang 6 p.m.
Yes, sir.
a.m. ba young?
No.
Ay, more on yin po ang si kidney po.
Okay. True or false? Ang kidney is a yin organ or more of a yang organ?
More on yin organ, sir.
So this is not your answer. Okay, what about winter? Is it yin or is it yang?
Winter is a yang po.
Anong yang? Winter.
Winter is
Malamig yun eh.
Malamig yung
Malamig,
winter. Ano ka ba? Baka nag-aircon ka pa pag winter. Grabe.
Di ba 6 p.m.
Okay,
to
so
6
ano
a.m.?
sagot mo rito?
6 p.m. to 6 a.m.
Anong 6
pag
p.m.?
winter, more on ano siya. Ano na siya? Yin na siya, sir.
Okay, ang chi, ano yan?
Yung chi is more on yang po siya, sir.
Okay, so yung
Yan
sagot
yun.
chi. Sinabi mo kanina, iba eh. Oh, which of the following is an indicator of yin deficiency?
Fear
Chi.
of cold. Ano
Fear
na,
of-
82 na tayo. Anong number na tayo, sir?
82.
Which of the following? sir?
Hanggang 90 ka. Isip-isip.
Fear of cold, pale or grayish face, low-grade afternoon fever po, sir.
Okay, very good. Which of the following is generalization of yang deficiency?
Usually likes a lot of clothes, fire, hot water bottles po.
Mahilig sa fire. Okay. Which of the following is an indicator of yin excess?
More on easily fatigued mentally and physically po.
Galing. Which of the following is generalization of yang excess?
Feeling of having insomnia and agitation po.
Wow. Which of the following is true?
Yin and yang can be 2 points on opposite end of a continuum.
Great. The yin organ, which
It
of the
stores the vital substances.
Very good. Yin and yang's change into each other is dependent on
The amount of yin within the yang and yang within the yin.
Would you like to change your answer?
Yin.
Saan mo yan? Nakuha mo yan sa libro? O hula mo lang?
Mali yung sagot ko, sir, no?
Mabuti alam mo. Okay. Stage of development, internal conditions. Okay? Depende sa ano mo. Okay. Fire's yin-yang pair is water because
Water, schools, and down bears.
Okay, and the last one, before we go to Mark, who is very prepared as well. If the weather becomes excessively cold, what happens?
Yin is consumed and yang increases. Tama po.
Okay, pag sinabi mong yin is consumed, umiinit ba o lumalamig?
Ano siya, umiinit, sir.
Bakit yan yung sagot mo?
Yin, di ba pag
Ang tanong natin,
nagiging
what
heat
happens
siya,
pag
parang gano'n.
excessively cold na yung weather? Nauubos ba si yin?
Hindi. Nadadagdag pa.
Nadadagdag si yin. Nako-consume si yang.
Yang.
Ang baligtad ako.
Okay lang. Ano yon? Penalty, 1,000, isang mali. Joke. Maraming salamat, Sir Walter.
Thank you again po.
Okay, next, let's hear Sir Mark from Bulacan. Sir Mark,
Yes po, Doc. Kung 100 lang ang sagot ko. 90.
ano yung
Sige
mukha
po.
mo? Which
Doc,
state?
hindi ko ba camera?
Wala kang camera?
Opo, di mabuksan po.
Okay. Sige, boses mo na lang. Which state does not result from a yin and yang imbalance?
Yin increase and yang is weakness of yin and yang.
Wow, bakit? Hindi siya nagre-result from yin and yang. Okay, weak. Any lump or mass that is hard is likely due to,
Excess of yin.
are you sure?
Nag-iisip ako, sir, kung pag may mas siya, magkakasya. Excess of
Ano
yang?
nakikita nyo? Okay, sabihin na natin may CA, no? Matigas. Titingnan mo yung dila niya, may mga red spots ka makikita, purple. Ano ibig sabihin yan? Actually, reddish-purple yung tongue. May mga red spots. Meron ako isang cancer patient, nagkikimo, medyo may mga red siya. So ano ibig sabihin nun? Excess of yang or excess of yin?
Excess of yin?
Yang. May mga red spots na nga.
Spots na siya. May
Red pala is
Hard
warm.
na yan. Hard na siya. Masakit na yan. Diba? Pag hard, masakit na yan.
Opo.
Which body structure pair represents yang or yin?
Back and front.
Yeah. Yang ang back, front. Okay. Full heat and full cold both have?
Excess.
Wow. Full is another name for excess. Okay. Which of the following pairs represent yin, yang?
Immaterial and material.
Wait,
Fire percent yin and yang, water and
isip-isip
fire.
mo na. Tinan mo, yin yung una, tapos yang.
Arising and descending.
Di ba pag
Yeah.
rising, yang yan. Tapos ito yin. Energy,
Energy
yang
and
muna, itong yin.
Energy matter. Sorry, energy matter.
Yung pangalawang sagot mo.
Energy matter, oo.
Hindi Water
Yung pangalawang
muna,
sagot
tapos
mo.
fire. Immaterial,
Matter and fire.
Material kasi yang yun.
yang. Material, substance, yin. When yin and yang are in balance, ano nangyayari?
Nothing can be observed.
Okay, wala ka pasyente. Okay. The Chinese characters for yin-yang are representations of, although, yeah. Ito, expertise si Dr. Kua. Marunong to sa ano siguro, ano ba tawag doon? Yung Chinese. Sa dami na characters. Sir Mark, ano na?
97.
Yeah, ano ang sagot mo dito?
The sunny and the dark sides of a hill.
Okay. In conditions of empty cold, treatment should
Tonify the yin.
tonify the yin. So lalong magiging cold.
Cold na pala dapat yang na natin. Okay.
Tonify mo na yung yang.
Oo, nalito.
Which statement is not true of yin-yang pairs?
When yin is excess, it forces a decrease of yang.
No.
Okay.
Yin can exist without yang. Hindi ito totoo. Hindi pwedeng mag-exist ang yin pag wala si yang.
Hanapin mo yung
Yin is to yang as blank is to blank.
Time is to space.
Hindi. Sino mo muna lahat ng choices?
Patingin nga po.
Yan, apat.
Not true pala. South and the north.
Moon is to sun.
Moon is to sun. Okay. Yin contains yang. Sometimes, always, Ano sagot?
Dok, wala na po akong sagot, Dok. Hanggang 100 lang po ako eh.
Ganun, adi sagutin mo na ngayon.
Wait lang.
Ay, balik natin kay Sir Walter, baka masagot. Sir Walter, hindi ka na magbayad ng 2,000. Sir Walter, ulit,
Ano po, number na po? 101 na?
101. Ano sagot mo rito?
Yin contains yang.
Yes. Sometimes, or only when yin is more substantial and yang is more ephemeral. Always, only if yang contains yin. Ano sagot mo rito?
Yung ano po, always po.
Wow. Always, meron talagang yang ang yin. Every treatment modality is aimed at one of these strategies, except,
Move the heat.
okay, you don't move the heat. You disperse the heat. Next, which of the following do not exhibit excess yang leading to deficient yin?
Excessive jogging leading to a very low pulse. Tama.
Do
Mali
not.
po.
Do not, ha? Yung hindi, ang sagot dito, exterior cold leading to internal heat. Hindi siya nag-exhibit ng excess yang leading to deficient yin. It is likely that early observations of yin-yang cyclical movement did not come from
Astrological observation po.
medical theory. Hindi siya nanggaling sa medicine.
Not medicine.
It is likely that early observations of yin-yang cyclical movement did not come from
Medical theory.
ay pareho lang the same, medical theory. Punta natin sa 106. A patient has external wind cold. Ibig sabihin, para siyang sinipon and later develops a fever. Which of the following is applicable?
Sounds familiar.
Yang damages yin.
Ano bang nauna? Si yang o si yin?
Yin.
So, si yin
Yeah.
transforms into yang.
Yin
Diba?
transform into yang.
Okay. Actually, when we treat yung mga ganito, especially pag wind heat, no? Lahat yan, wind cold, wind heat, may fever yan. So minsan minimitigate, ini-expedite na natin. Kailangan magka-fever na para hindi na tumagal. So meron tayong point na ginagamit, LI. But that's another story. Anyway. 107. A patient has kidney yang deficiency and develops anemia. Which of the following is applicable?
107, no? Hypoactivity, sir.
Yeah, anong sagot mo rito?
In the message.
Okay. Ano ba yung anemia? What do you mean by anemia?
Kulang sa red blood cell.
Okay. So pag nagkulang ka
Kulang sa iron, sir.
ano ang na-damage mo? Ang yang o ang yin?
Ang yang.
Green.
Di ba red blood cell?
Liver.
Ang na-damage yung yin.
Yin ang na-damage.
Yes. Which of the following is not a yang symptom? Ito yung sinagot mo yata kanina na una ka. Go.
Which of the following? Ano? Talkative, sir. Ano po ba yung...
Ano dito yung hindi yang symptom? Ito yellow, yang na yang yan. Dry throat, yang. Constipation. Ano na? Nasagot?
Hypoactivity.
Hypoactivity. Which of the following is not a yang symptom?
Sir, pwede patingin ano? Iba yung question ko. Which of the following?
Yeah, it's not a yang symptom. Can you see it? Yeah.
Cognitive disease.
Okay. Yin yan eh. Yang deficiency. Okay. Degenerative disease. Which of
Degenerative.
the following is not a yang symptom? Ibig sabihin, yin siya.
Acute disease, sir.
Mm. Hindi, alin dito ang hindi yang na symptom? Ibig sabihin, yin na yin siya.
Past pathological change.
Hindi, yang yan eh.
Acute disease. Acute disease po.
Like
Ano ba acute
curl
disease?
up.
Yang or yin? Sabi nyo kanina, yung chronic ang yin. So, yung acute, yang.
Yang, acute
Yung
na
acute
yang.
is yang.
So, ano to? Itong likes to curl up.
Yin yung likes to curl up.
Yes.
Yan.
Oh, ano na nangyari, Sir Walter? Dadagdagan ba natin ng 10,000? Which of the following is not a yin symptom? Kanina lang to eh. Di ba ikaw yung
Acute.
nito?
Acute disease.
Yes. Kasi yang symptom ang acute. No? Ito, yin na yin, oh. Wants to be covered, nanlalamig, lies curled up. Parang lethargic. A patient has a fever and later develops thirst. Which of the following is applicable? Ano nangyari dito? Nag-fever siya, tapos nagkaroon ng thirst. Bakit siya naging thirst? Kasi umama siya. So anong impact nitong heat? Naubos si yin.
Naubos si yin.
Yang
Kaya
consumes yin. Clear? Okay, which of the following is not a yang symptom? Sir Walter, you have to redeem yourself, okay?
Number 12. 112 po.
No, 113 na tayo. Which of the following is not a yang symptom? Coarse breathing, slowly changing symptoms, thirst for cold drinks, scanty dark urine.
Scanty dark urine po.
Sure ka? Yang yan eh, di ba?
Yang.
Scanty, dark. O konti lang.
Slowly changing symptoms. Another word for chronic.
Slowly changing symptoms. Ha? Dahan-dahan. Mabagal. Hindi siya yang.
Mabagal.
Which of the following is not a yang symptom? Sir Walter.
Clear and copious secretion.
Very good. Which of the following is not a yin symptom?
Restlessness.
Yes. Which of the following is not a yin symptom? Paulit-ulit na.
Drops of bedclothes.
Yes. Which of the following is not a yin symptom?
Excessive.
Yes. A patient has a high fever and later develops chills. Which of the following is applicable?
Yin transforms into yang.
Okay. Ano ba ang high fever? Yang o yin?
Yang.
Yang consumes yin.
Yang consumes
yin.
Yang.
Or yang
transforms
transports into yin pala, sorry.
Transforms to yin.
A patient sweats excessively and later develops cold limbs. Naubos. Which of the following is applicable?
Yin damages yang.
Okay, galing. And finally, the last one. Which of the following is not a yin symptom?
Right.
Loose stools.
Sure ka?
Yeah.
Yin yan
Yeah.
eh.
Is not.
So, ibig sabihin yang. Alin dyan yung yang?
Anong
Yung right. May mainit daw.
Mainit, tuyo.
Dry throat.
Dry throat.
Tsaka
Okay
Dry
na,
throat.
pagod na kayo. Maraming salamat po. Thank you for joining. Dr. Kuwa, nakarating siya
Thank
sa
you po, thank you po.
Thank you so much. I hope you all enjoyed today's this week's assessment. We hope to see you again next Monday. Maraming salamat po. Magkikita tayo ulit mamaya. Kumain muna kayo ng 5 minutes. Thank you.
Sige po.
it's
Maraming salamat. Bye-bye. Thank you po.
5 minutes.